Did you know that consuming vitamin D can help you reduce or stop proteinuria and heal your kidneys? Proteinuria is a condition of high levels of protein in urine. It affects almost 6.7% of the population in the U.S. While it is not a disease itself, it can indicate kidney damage or any underlying disease. This is because normally kidneys filter wastes and excess fluids from our blood through urine. Their filtration system does not allow large protein molecules to pass through them and keep them in the blood. However, when kidneys are damaged or are not performing their functions properly, their filtration system may start leaking proteins into the urine. The normal range of protein in urine is less than 150 milligrams per day. If it is greater than this, it can be concerning for you and you need to stop this. This is where vitamin D can help. But it's not the only vitamin. Many other vitamins can also help. In this video, let's explore the top 4 vitamins that help stop proteinuria and heal your kidneys. Let's begin. Number 1. Vitamin D. Vitamin D can help you stop proteinuria and heal your kidneys in several ways. Firstly, vitamin D has anti-inflammatory properties and helps reduce inflammation throughout your body, including in the kidneys called glomerulonephritis. Glomerulonephritis can damage glomeruli, the tiny filters in your kidneys, and make them leak proteins into the urine. By decreasing this inflammation, vitamin D can help you heal your kidneys and reduce proteinuria. Vitamin D can also help regulate blood pressure, a main risk factor for kidney damage. This is because high blood pressure can also damage glomeruli, the tiny network of blood vessels that are cleaning units of your kidneys. This damage can lower their glomerular filtration rate and may leak proteins like albumin into urine. Moreover, when kidney tissues are damaged, they may work hard to increase blood flow, which can cause further damage and increase proteinuria. So, vitamin D can help stop proteinuria by regulating blood pressure. It lowers the secretion of enzymes and hormones like renin and angiotensin, which are responsible for blood pressure regulation and sometimes can cause high blood pressure in the kidneys. It also maintains the flexibility and health of blood vessel linings. Vitamin D deficiency can make arteries stiff and make it harder for blood to flow properly, which can increase blood pressure. Moreover, vitamin D also has antioxidant properties, which protect your kidneys from damage caused by free radicals. Free radicals are unstable molecules formed during natural metabolism in the body or from external factors such as smoke, radiation, and pollution. These molecules react with other molecules and damage tissues and cells throughout your body, including kidneys. Antioxidants neutralize these free radicals and prevent them from damaging the glomerular filtration system, which can cause proteinuria. By reducing inflammation and oxidative stress, vitamin D may also help prevent the formation of scar tissue in your kidneys. Scar tissue can degrade kidney function, so preventing it helps maintain the kidney's ability to filter waste and proteins efficiently. A 2019 study has shown that a dose of active supplementary vitamin D could lower the severity of proteinuria among chronic kidney disease patients. So, to manage proteinuria and heal your kidneys, you should consume enough vitamin D. The recommended daily intake of vitamin D for children and adults is 600 international units or 15 micrograms daily, and for above 70 years is 800 international units or 20 micrograms daily. However, nearly 41% population in the U.S. has vitamin D insufficiency, so try to get enough vitamin D. You can get this vitamin D from sunlight. This is because the skin produces vitamin D when exposed to sunlight. However, if you get insufficient sun exposure, especially during winter, or if you live in northern latitudes, you can also get vitamin D from natural food sources. These food sources include cod liver oil, fatty fish like salmon and mackerel, liver, and egg yolks. Moreover, other sources from which you can get vitamin D include UV-exposed mushrooms and fortified foods with vitamin D including milk, plant-based milk, yogurt, and certain cereals. However, check nutrition labels to find out how much vitamin D these products contain. Dietary supplements of vitamin D are also available. When choosing vitamin D supplements, you might find 2 forms of vitamin D, D2, ergocalciferol, and D3, cholecalciferol. Vitamin D3 is often recommended and considered better because it is more efficiently used by the body and maintains blood levels of vitamin D more effectively. If you have chronic kidney disease, your healthcare professional may prescribe alpha-calcidol, a vitamin D supplement. This is the active form of vitamin D given to CKD patients because their kidneys may not effectively convert vitamin D. The recommended daily dosage of alpha-calcidol is typically between 0.25 and 1 micrograms. When it comes to how to take vitamin D, you can take vitamin D at any time of day, but try to eat it with foods that contain healthy fats, like olive oil, fatty fish, nut butters, etc. This is because vitamin D is a fat-soluble vitamin, so it is best absorbed with these foods. Moreover, make sure to take vitamin K2 with vitamin D. This is because vitamin D increases the absorption of calcium and phosphate from your intestines into your bloodstream. Vitamin K2 activates proteins that direct these minerals to your bones, where they are effectively used to strengthen them. Without enough vitamin K2, excess minerals can build up in your bloodstream and cause your kidneys to work harder. This can lead to the formation of calcium oxalate stones. Taking vitamin K2 with vitamin D helps your body use minerals more effectively, reducing the risk of kidney stones and supporting overall mineral balance and health. Look for vitamin D supplements that contain vitamin K2. Also, remember that vitamin D is fat-soluble and stored in body tissues, so taking it in high amounts can cause toxicity and may show up as symptoms like nausea, dry mouth, weakness, and serious complications like kidney issues. Number 2. Vitamin B complex. Vitamin B complex is a group of essential vitamins including B1, thiamine, B2, riboflavin, B3, niacin, B5, pantothenic acid, B6, pyridoxine, B7, biotin, B9, folic acid, and B12, cobalamin. This vitamin B complex group can help you manage proteinuria and heal your kidneys in several ways. Firstly, vitamins B1 and B6 in particular can help you manage blood sugar levels. This can help because high blood sugar levels are an important risk factor for kidneys. They can damage blood vessels in your kidneys and degrade their function. When their function is degraded, the kidney may leak protein into the urine. So, vitamins B1 and B6 can help you lower blood sugar levels and heal your kidneys. Secondly, vitamins B6, B9, and B12 can help by lowering homocysteine levels in your blood. High levels of homocysteine in your blood are a risk factor for cardiovascular disease and hypertension, both of which can damage kidneys. As mentioned earlier, high blood pressure can damage kidneys. Moreover, high blood pressure is the second leading cause of kidney issues worldwide. So, by lowering homocysteine levels, these B vitamins help protect your kidneys. Moreover, kidneys produce erythropoietin, a hormone that stimulates red blood cell production in response to falling oxygen levels in body tissues. When your kidneys are damaged, they may not efficiently produce erythropoietin and cause anemia. Anemia can reduce oxygen supply to your kidneys, damaging kidney tissues and degrading their function. When their function is degraded, this will overall affect the filtration ability of kidneys and can cause proteinuria. Vitamins B6, B9, and B12 are essential for red blood cell production. B6 helps produce hemoglobin, B9 is important for DNA synthesis and cell division, and B12 works with folate to form healthy red blood cells. Together, they ensure your body can efficiently produce and maintain healthy red blood cells. This can help you treat anemia, supply enough oxygen to your kidneys, and support their healthy functioning. So, consuming vitamin B complex can help you stop or reduce proteinuria and help your kidneys in their healthy functioning. The daily recommended intake of all the vitamins in the B complex is different. Daily recommended intake of B1 and B2 is about 1.2 milligrams for men and 1.1 milligrams for women. B3 is about 16 milligrams for men and 14 milligrams for women. B5 is about 5 milligrams for both men and women. B6 is 1.3 milligrams for both men and women. B7 is about 30 micrograms for both men and women. B9 is about 400 micrograms for both men and women, and B12 is about 2.4 micrograms. However, if you have kidney disease, your vitamin B complex needs may differ, so it's essential to consult with your healthcare provider before taking supplements. You can easily add vitamin B complex to your diet from natural sources. These sources include whole grains like brown rice, barley, and millet, meats including chicken, turkey, and red meat, dairy products including milk, cheese and yogurt, eggs, nuts and seeds like sunflower seeds, and almonds, leafy green vegetables like spinach and kale, and fortified foods like cereals and bread. Moreover, vitamins are water-soluble. Their excess amounts are excreted through urine, and they are not stored in your body, so restore them daily through diet or supplements. However, remember that while excess amounts of vitamin B complex are excreted through urine, taking too much can still cause many side effects. For example, high doses of vitamin B3 can cause liver damage and vomiting, and B6 can cause nerve damage. So, stick to recommended dosages and consult your healthcare provider, especially if you have kidney disease. Number 3. Vitamin E. Vitamin E is another essential nutrient that can help you manage proteinuria and support kidney health. Similar to vitamin D, it helps reduce inflammation and protect tissues from free radical damage. As mentioned earlier, inflammation and free radicals damage kidneys, degrade their function, and can cause protein to leak into the urine. So by neutralizing these free radicals and reducing inflammation, vitamin E can protect your kidney cells and help reduce proteinuria. Vitamin E also promotes autophagy, a cellular process where cells break down and recycle their damaged or unwanted components and repair themselves. This can help maintain the health of the cells lining the kidney's filtration system and improve their functioning. So, by enhancing autophagy, vitamin E helps these cells function better and can reduce protein leakage. Moreover, vitamin E may help cells conserve their energy by limiting excessive autophagy and ensuring the process is completed efficiently. This reduces waste accumulation during cellular maintenance and can improve overall kidney function and reduce proteinuria. So, by adding vitamin E to your diet, you can support your kidney health and lower proteinuria. The recommended daily intake of vitamin E is about 15 milligrams for both children and adults. For those with kidney disorders, this may be lower to 8 to 10 milligrams per day. You can easily get vitamin E from natural sources like plant-based oils, including sunflower, safflower, and wheat germ oils, nuts and seeds, including almonds, sunflower seeds, and hazelnuts, and vegetables, including broccoli and spinach. Moreover, you can also opt for vitamin E supplements or cereals, breads, and other foods that are fortified with vitamin E. However, check nutrition labels to determine the amount of vitamin E in these foods. When choosing supplements, it's recommended to look for those containing D-alpha tocopherol, the natural form of vitamin E, because it is more bioavailable and better utilized by the body compared to the synthetic form, D-alpha tocopherol. The natural form has a higher potency and efficiency in providing the antioxidant benefits associated with vitamin E. Remember to take vitamin E with foods containing healthy fats for better absorption. You can take it at any time of day, but some people use it to help with insomnia and prefer taking it at night. Always consult your doctor before taking vitamin E to avoid potential side effects and interactions with medications. Number 4. Vitamin C. Vitamin C is well known for its benefits for improving the overall immune system and can also help you maintain kidney health and reduce proteinuria in several ways. Vitamin C is an antioxidant. It neutralizes free radicals and protects your whole body, including kidneys, from damage caused by these unstable molecules. It also lowers inflammation, helps prevent further damage to your kidneys, and can support their overall function. When their overall function is improved, their filtration system may reduce the leakage of protein in the urine. Vitamin C also plays an important role in the synthesis of collagen, a protein that is a building block of muscles, tissues, tendons, bones, and other connective tissues throughout the body, including your kidneys. So, it can help maintain the structure and integrity of the kidney tissues and blood vessels. Its proper levels can help your kidneys to function effectively and stay healthy, which is essential for preventing protein leakage into the urine. A study involving diabetic rats showed that vitamin C treatment significantly reduced proteinuria. So to heal your kidneys and reduce proteinuria, you should add enough vitamin C into your diet. The recommended daily intake of vitamin C for adults is 90 milligrams for men and 75 milligrams for women. You can easily get it from natural sources like red bell pepper, citrus fruits including oranges, lemons, grapefruits, and limes, Berries, including strawberries, raspberries, and blueberries, kiwis, and dark green vegetables, including broccoli, Brussels sprouts, and kale. Moreover, you can also get it from vitamin C supplements. Vitamin C is water-soluble, which means your body does not store it, and excess amounts are excreted through urine. Restore it daily through dietary sources or supplements. However, high doses of vitamin C, above 2,000 milligrams per day, can cause side effects such as kidney stones, diarrhea, and stomach cramps. Always consult your healthcare provider before taking high doses of vitamin C, especially if you have a history of kidney stones or other kidney issues. When it comes to how to take vitamin C, you can take it at any time of day, with or without food. Since it is water-soluble, it should not be taken with fats for better absorption.